All right, now we have blood types, right? So we talked about the 4 different types of blood type. Is that how many blood types we have? Is that what I said? Are you gonna believe what I said? No, it's a lie, right? So you don't have 4 different types of blood types. There are actually 8, right? And the difference is whenever you actually get your blood type, so it's really important to know your blood type, is the positive and negative sign. The positive and negative sign is determined based off of this other antigen that's present. It's called the Rh factor. Rh factor is a subgroup of about 150, 1 in 50 different type of blood types. There's multiple. The most common blood types that we focus on in practice is the ABO and the Rh system. Everything else is not really relevant because it doesn't necessarily always create some kind of immunogenic response, right? But the Rh factor here that is present is measuring a specific subgroup of antigens, which is called D antigens. So this D antigen, again, the same thing as Rh, right? The presence of this factor. This presence of this Rh factor, D, tells you whether you have a positive or negative blood type, right? So if this Rh factor is present, so if it's present, we put a positive sign, so check. If it's absent, we put a negative sign, so it's not really present here, okay? And again, remember, Rh factor is also an antigen, just like the A, B antigens that we discussed in the previous lectures, right? It is not an antibody, so it's not responsible for the immune response, but it can trigger an immune response, right? So, if we're going to give an example. So now now you have 2 different types of antigens that we're studying now. The ABO, and then you have the Rh positive or negative. So you have 8 total blood types. So you have A positive, negative, B positive, negative, O positive, negative, and AB positive or negative, right? And so what becomes really important is when we look at blood transfusions, right? So the same process can happen when we look at the agglutination, right? So if I have a O negative versus an AB, let's do an O positive and an AB negative, right? So if I want to go in this direction first, is this possible? Can this be actually applicable? Right? So what's really important is to make sure you match not only the antigens of the ABO, but also the Rh, right? Because this Rh positive, if present in your body, can actually trigger the process of agglutination. So it's really important to be able to match the Rh factors and the antigens in order to prevent any kind of immune response, right? So you have AB going into the O, right? Is this possible? Or is this going to cause some kind of immunogenic response? Well, even though you can see that the Rh factors match, right? So there's no presence of Rh here, where there is a presence here. So the Rh will not cause any kind of agglutination. However, remember from the previous table, O has both A and B antibodies. So this would cause an actual immunogenic response, right? So this is dangerous, right? So you don't want to have this agglutination taking place. Let's do the opposite now. So now let's do AB, so O positive, right? So remember, O was the universal donor and AB was the universal recipient. So if we go this way now, same thing, same process, O going to AB. So if we look at just the AB and the O, right, we can notice that, no, this is fine. If there was no signs here, this would work perfectly, because there is no antibodies present in the AB that's directed against the AB antigens in the blood type O. However, what you notice here is you see a positive and a negative. The positive is indicating the Rh factor, whereas the negative is indicating no Rh factor. So if the O positive were to give blood to the AB negative, this would cause another immunogenic response. And this process would lead to agglutination, right? So if I were to rewrite this, so we already wrote before that this here was O was the donor, right? So this was the universal donor, and we said that AB is the universal recipient, right? So in actuality now, because we have the Rh factor now, it's important. What is the true universal donor? What is the true universal recipient? So the true universal donor actually now is O negative. So O negative is the universal recipient, whereas the AB positive is the universal donor. Excuse me, mix that up. So universal donor is the O minus, right? So let's cross that out. Universal donor is the O minus, and the universal recipient is AB positive. So universal recipient. And that's the general blood type that's standard in the clinical practice.